Today, we're taking another look at Chapter 1 of our Human Anatomy and Physiology text. In our previous meeting, we defined some terms, we defined anatomy and physiology. We looked at some of the levels of organization within the anatomical makeup of the body, and we talked about homeostasis. And what we meant by homeostasis was the ability to maintain a constant internal environment in the body in spite of changes outside the body that challenge the body, or constant conditions within a cell in spite of changes that occur outside the cell. Those are properties of living things, and homeostasis requires a system in place to maintain the integrity of those variables, those characteristics of the fluid inside our body, for example, and the blood. So let's look at a generalized scheme or homeostatic control system by which we can maintain particular variables within a standard range, or what we call a normal range. A stimulus, actually jumped ahead of myself, a stimulus is what we call a change in the variable. So if we're talking about a particular condition in the body, there's a normal set point, if you will. That's an old-fashioned term, but for the variable. For example, what's your body temperature? Well, it's 37 degrees Celsius. That's a variable that's maintained by homeostatic mechanisms. A stimulus would be a condition in which the body temperature was rising, for example. Okay, so, oh, I have trouble with my mouse. A receptor, in order to know that the stimulus has occurred or that the variable has changed, there must be some sensor within your body that can detect that change. That's called the receptor. So as we're studying throughout the semester different body systems, I want you to always be thinking, wow, I wonder what is the receptor that can maintain that particular thing, like, for example, calcium concentration in the body fluids at a standard level. The receptor then reports information along what's called an afferent pathway, incoming information to a control center that can make some decisions about what to do and then dish out some information, some orders, by way of what's called the efferent pathway, the outgoing pathway of information, to effectors. And effectors are organs or structures within your body that can alter the value of a variable. So the effector will reduce the stimulus, in other words, return the variable closer to its original or its normal value, if you will. That's why this is called a negative feedback system. When a stimulus occurs, we want to reduce the magnitude or size of that stimulus. We want to reduce the size of that change so that the variable stays within a narrow range within our body. That's the predominant way that our bodies and our cells maintain constant internal conditions. I'm going to introduce another type of control system called a positive feedback system or mechanism. And I don't want you to think, oh, there's this and there's that and they're equal in typicality or whatever. Negative feedback mechanisms represent the vast majority of control systems that maintain homeostasis in our bodies. We're going to go on now and talk about an example of a homeostatic control mechanism. Body temperature. So anytime you exercise, your skeletal muscles start producing more heat, and that heat accumulates in your body initially. Your body temperature rises. Or if you go outside in the sun on a hot day, there is radiation energy from the sun striking your body and adding energy to your body. Your temperature begins to rise. So there's receptors. There are neurons whose role is to simply detect changes in temperature in your skin and also down in the deeper parts of your body, within the organs of your body. And when the body temperature starts to rise, those receptors send information to your hypothalamus within your brain that has thermoregulatory centers. The hypothalamus will determine what needs to be done, and it will dish out efferent pathway information to the effectors. What may happen? Sweat glands will be activated, right? We'll have some sweat, which will then, as it evaporates from the body, will remove energy from our body and bring the temperature back down. Vasodilation, you'll also see redness. That's another effector. The blood vessels in the skin will dilate and let more of the hot blood from deep in the body get near the surface so we can help remove some of that extra energy and lower the temperature of the body. So it's a negative feedback system. If your body becomes cold, if you go outside in the wintertime and the temperature is cold, and so there's going to be a faster rate of heat escaping from your body, and at a constant rate of heat production, then your body temperature will start to go down. There are specialized neurons that will detect that drop in body temperature, the receptors, which will send information along their axons to the hypothalamus. The hypothalamus will recognize that there's a drop in body temperature and activate effector organs, which will help bring the body temperature back towards normal. Not too normal, but back towards normal. As long as you stay outside, your body temperature is going to be a little lower than it would have been until you come back into the living room. The effector organs might be skeletal muscles, right? We will start shivering. That's just muscles working, just releasing heat from oxidation of fuel molecules and from breakdown of ATP molecules. We're going to release a lot of heat energy and start warming the body back up. Also, you'll have vasoconstriction happening. Blood vessels will constrict to take the hot blood away from the surface. Your skin will start to look a lot more sort of pale in complexion compared to its normal look, and that'll be another way that you can conserve heat so that your body temperature starts to go back towards normal. Okay, what about a positive feedback mechanism? There's a couple of examples that are commonly used to illustrate a positive feedback mechanism, and one of them is the contraction of the uterus during parturition or childbirth. So what happens? As the uterus begins to contract, the head of that baby, hopefully the head, starts pushing on the cervix, a ring of muscle at the outlet of the uterus, and it begins to stretch the muscle cells within the cervix. And there are sensory neurons in the cervix that detect that stretch, and they signal the brain to release oxytocin. And oxytocin enters the blood, and it triggers uterine contraction, right? So we have this feedback loop. Oxytocin causes more uterine contraction, which deforms the cervix or stretches the cervix more, which causes the release of more oxytocin, which then feeds forward onto the uterus and more contraction. We have this rising level of oxytocin in the blood and rising degrees of contraction of the uterus until eventually birth occurs. So that's a positive feedback system. The variable, the change, is increasing the oxytocin concentration and so forth. Blood clotting is another popular example of a positive feedback system. When a blood vessel becomes torn, which happens every single day, at least at a microscopic level, blood begins to escape. We don't want that. We want to keep the blood in there. And there's a positive feedback mechanism that's initiated involving platelets. When platelets come in contact with the torn wall of the blood vessel, they become activated and they begin to stick to that blood vessel wall. And as they stick, they become activated. They release chemicals that make other platelets that are floating by in the blood more sticky, and they begin to stick and accumulate, and more platelets begin to accumulate at the site of this injury or this damage until they block off that part of the vessel so the blood can no longer come out. That's called a platelet plug. We have a rising amount of chemicals released from platelets. We have a rising number of platelets stuck at the site until eventually they block the blood from escaping. That's a subtype of homeostasis called hemostasis, keeping the blood within the vascular system. Hemo just means having to do with blood. We're going to keep that blood in there. There are subsequent things that take place that also involve positive feedback activity, the blood coagulation or clotting, but we'll talk about that another time. If homeostasis cannot be maintained in some instance, your authors like to use the term homeostatic imbalance. We also call that a disease. When something is not working correctly in the body, that's what we mean by a disease. It can be caused by infections. It can be caused by all kinds of different things. So that's where we're going to leave that right there. Homeostatic imbalances, we'll encounter them in every chapter, every organ system of our body as we go through. This chapter has a number of terms that allow us to speak efficiently about anatomy. And some of the terms that you see on this diagram referring to regions of the body are probably very familiar. Let's find an example that's very familiar. The pelvic region, right? We know where our pelvis is, the big bones of our hips. And so the pelvic region is this region of the body, sort of bounded off and drawn in purple. But every region of your body has a special name that's particular to the practice of anatomy. And again, it's efficient to use those terms to describe parts of the body instead of having to give a sort of operational definition of every part of your body. So I want you to learn these terms. Get out a notebook and make a list for yourself of all the terms in this diagram that you don't know, that are not familiar to you, and then write a little definition of them that you can use to study from until you can just cover up all the terms on this diagram and name all those parts. For example, the carpal region. Carpal means of the wrist. Antebrachial means the anterior of the forearm. Anterior of the body is the front, right? This position, incidentally, that you see this cartoon diagram of a man in is called anatomical position. Very important. The man has his body positioned in a linear fashion. We have the torso or trunk, and the appendages, the arms and legs, are extending linearly from the torso, and the arms are at the side, and the palms are facing forward. That's called anatomical position. It's a reference point, a starting point for discussing any position of the body. And then we can use these terms to describe regions of the anterior of the body. There are terms that refer to regions of the posterior of the body. So again, get your notebook out, take a look at some of these terms, and you'll find that some of them are very unfamiliar, and so I want you to learn those terms. That's your homework, your take home from this chapter. One of the things you need to do is to learn these terms. People often ask me, do I need to know how to spell these things? Well, I'll give you an example why it's probably a good idea to be able to spell these terms. The perineal region refers to the lateral or side of the lower leg. The perineal, with one letter change, refers to the region between the anus and the external genitalia. Very, very different, and we don't want to interchange those in conversation. So yes, science is about precision. Each one of these terms has a very specific spelling and a specific pronunciation, a specific meaning. So yes, you should learn how to spell these terms and be able to reproduce them for me at a future time when I may ask you about them. Here are some anatomical terms you should know that refer to directions when we're talking about the body, so we can compare the relative positions of things. So if we're talking about something that is closer, more towards the head in the torso of the body, we'll call that superior, right? If we're looking anywhere on the trunk of the body or the neck or the head of the body, we'll be able to talk about things that are superior or inferior. If we're talking about something that's in a lower position relative to some other part of the torso, we'll say it has an inferior position. Again, we have to differentiate between our scientific terms, which are now our technical terms, which we'll be using forever after, and the sort of colloquial meaning of inferior and superior. Ventral refers to the anterior of your body in anatomical position. Dorsal refers to the posterior direction on your body. Anything that's farther towards the back is more dorsal than some other structure in your body. Any part of your body that's closer to the center line of your torso than some other part is said to be medial to it. Any part that is further away from the center of your torso relative to another anatomical entity is said to be more lateral. So those are important terms to describe those directions. What about the appendages, the limbs? We can't use superior and inferior to talk about the relative position of anatomical features of the limbs, because we can move the limbs. You can take your arm and raise it up over your head, and all of a sudden what used to be inferior and superior have been reversed. So those terms won't work, and we'll therefore use proximal to refer to elements or structures of your arms and legs that are closer to their attachment to the torso. And we'll use the term distal to refer to aspects of those appendages that are further from the attaching point to the torso. So proximal and distal come in very handy. Superficial just means closer to the surface of the body. Deep just means deeper relative to some other anatomical structure. There are ways of thinking about the body that refer to particular planes that we may imagine slicing through the body. If we imagine a plane which divides the body into left and right regions, here's what's called a median plane or a sagittal plane. A sagittal plane is any plane that you can imagine that would divide the body into left and right components. So that's called a sagittal plane. You need to know that term. The median plane or mid-sagittal plane is the one that divides the body equally into left and right halves. Why do we care about these things? Because oftentimes we would like to ask for a high-tech image of the body at some specific region or location. We may ask a technician to produce for us a mid-sagittal image of the body, such as this one here, a median section of the body, using some imaging technology. We may know that we want to look at the entire spinal column, and so we want to ask for a median plane image, and what we're looking at is everything that touched that imaginary, that would be visible touching that imaginary plane, dividing the body into two equal halves, left and right. So you get the idea of a sagittal plane. A frontal plane or coronal plane is any plane that divides the body into anterior and posterior sections. So frontal or coronal planes are perpendicular to sagittal planes. And then finally, transverse planes divide the body into superior, the torso, the superior and inferior parts. And so we'll use those terms to ask our technicians to produce images that will help us observe the interior of the body and diagnose disease and so forth. So you need to know the names of those planes, but also like to introduce you to some specific imaging technologies. And you've probably heard of these things. We'll just take a very quick moment and look at the differences between some of the imaging technologies that we can request at any plane of the body that we want. So I don't know how Pep got stuck down there at the bottom. I wanted to first talk about magnetic resonance imaging. It's a way of imaging the body. We won't go into the details of the technology. We can talk about that at some point if you're interested. But what we're going to be able to do is look at features, details in soft tissues, they're called. So MRI allows us to see inflammation, infections, tumors, defects in soft tissues, they're called, in the organs. CT scans, as we'll see in a minute, are scans that are good at identifying bones and joints and so forth, but they don't really show up much of the details of organs. So MRIs allow us to see the organs. Oftentimes we can take gadolinium, a chemical element, and use it in a particular chemical form which is non-toxic, inject it into the body, and it'll give us even greater ability to see details of soft tissues, organs, and so forth. So we'll use contrast media to improve the resolution of our images. Functional MRI is a technology that allows us to see the degree of blood flow in some part of the body relative to another, or changes in blood flow. When you think of functional MRI, think of learning to identify which parts of your brain function in what capacities. If we use functional MRI to look at changes in blood flow in the brain, and we challenge the brain with some task, some mental task, and we see some region of the brain suddenly increase in blood flow, we know that the neurons in that part of the brain, or those parts of the brain, increase in metabolism, metabolic activity, energy consumption in order to do the tasks that we ask it to do, and therefore more blood flow will be required and will be called upon by those cells, those tissues to supply them with glucose and so forth. So that's one way we can get a handle on how the brain works in different parts of the nervous system. CT scans might have been better to start with that, I suppose, in some ways. It's basically just 3D X-rays. X-rays, we're going to take some electrons and shoot them in high velocity, high energy electrons, and shoot them at the body, and they're so energetic they just pass right through most of the tissues unless they hit some of the crystalline extracellular matrix of bones, and that sort of absorbs those X-rays or scatters them, and we wind up with light areas and darker areas where there's soft tissues. So CT scans allow us to get great resolution. We can use contrast media, though, to improve the resolution of CT scans as well. We can add contrast media to the digestive tract or to the blood vessels. PET scans allow us to observe the metabolic activity of parts of the body using radioactive tracers attached to certain chemicals, like, for example, glucose molecules. If we wanted to see where there was some very metabolically active tissue, we could attach some radioactive isotope to glucose molecules, inject them into the body, wait for a while for all the cells to take up glucose because they're doing metabolism, and look for super bright areas where there's a lot of radioactivity that produces a brightness on the PET scan, and that'll give us a handle on where maybe a tumor lies, because tumor cells, cancer cells, tend to be unregulated monsters just chowing through energy molecules like crazy, and that allows them to show up on there. Body cavities, we should be able to give names to various cavities in your body in which the organs are found. I'll just quickly mention what you can already see in this diagram. The body is divided up into two cavities. The dorsal cavity, the back cavity, which is where your brain and spinal cord lie within the spinal column, and the ventral cavity is all of what you see in red. Then we can then subdivide the ventral cavity into the thoracic cavity and the abdominopelvic cavity. This whole region here is the abdominopelvic cavity. Then we can subdivide that into the abdominal cavity and the pelvic cavity. And then we can divide the thoracic cavity into the pleural cavities, left and right, and the mediastinum, or mediastinum is this middle part. The mediastinum can then be further subdivided into the superior mediastinum and the pericardial cavity. The pericardium is the area around your heart. So your heart lies in the pericardial cavity. Your lungs lie within the pleural cavity. Your digestive organs and your liver and so forth lie within the abdominal cavity. Reproductive organs lie within the pelvic cavity. So you can see how important it is to know the names of the cavities so we can refer to things happening in there. So I want you to be able to give that complete breakdown of the cavities if I ask you to do so. There's two general types of membranes that form boundaries between the organ systems in the outside world and that line these body cavities. Let's take a look. Body cavities are often lined by membranes, boundaries, linings that separate the cavities from other parts of the body. So the pleural cavities, for example, where your lungs are located, there's a lining attached to the pleural cavities covering the surface. There's an identical second lining that's attached to the surface of the lungs, and together they produce what's called the serous pleura, or pleural linings. So the pleura are the linings of the lungs. The pericardium lines the pericardial cavity and the heart. So we have this double layered lining of the heart. The peritoneum lines all the organs in your abdominal cavity and also the lining, the walls of the abdominal cavity. So let's see how they're kind of situated. Here's a little cartoon to help you understand what I mean by the double layer. The pericardium represents a double layered serous membrane, one layer of which lines the actual cavity, the pericardial cavity, and an identical layer which lines the outer surface of the heart. So we have this double layer of serous membranes, and serous means watery, and there's a lubricating fluid, a tiny volume of lubricating fluid between these linings that allows the two layers to glide with no friction, and the heart can really writhe as it's beating and pumping blood without any friction at all, taking away from some of the work that it's doing. All of the work goes into pumping blood. So that's the function of serous membranes. The pleural membranes allow the lungs to expand and glide on the surface of the pleural cavities without rubbing and chafing. The peritoneum allows the intestines to move all around during the mixing and churning of digestion and absorption without chafing and so forth. So the serous membranes are these lubricating, watery, double-layered membranes. Then mucous membranes line those body systems or organ systems that I mentioned almost at the beginning in the first section, that line the organ systems that are exterior to your body, the digestive tract, the respiratory system, the urinary system. Those systems essentially form boundaries between the outside world and the inside of your body. They're called mucous membranes. They're single-layered, mucus-covered, moist membranes that have a layer of mucus on the surface. There's a cellular boundary there. There's some mucus there that has some chemical properties that form a protective boundary between the inside and outside of our body within these organ systems here. So those are mucous membranes. Finally, the last slides in this in this PowerPoint, I believe they're the last slides, talk about different quadrants of your body, so that if you're again trying to communicate efficiently and rapidly to somebody about something that's happening pathologically, perhaps in some part of the body, we can refer to the quadrant in which it lies. There's pain in the upper right quadrant. Patient is in such and such condition. That allows us to communicate with, say, somebody in an emergency medicine capacity about what we're experiencing. They will immediately bring to mind these organs. That's why it's important to know these quadrants and what lies within them. In addition, there are these regions of your body, these 9 regions of your body that you should know the names of, which seems like a little off-putting at first, but you'll see there's some redundancy in the way these are named, so it's not so bad. But again, I want you to know these 9 names. I want you to be able to recite them, fill in this grid, a blank grid, without the slightest hesitation. That's how much studying I want you to do, because I don't want you to have to sit there and deliberate for minutes of time and guessing it. I know it's either this or that. Really learn these names. And I also want you to be able to say what organs would be found in each one of these regions, so that, again, if you're communicating with somebody about something you're observing in a patient, for example, and you can immediately refer to a region of the body, and the listener will not need for you to describe further what might be going on. They'll immediately picture the organs that lie within that region, and then immediately, again, begin to list out in their mind some maladies that might produce the symptoms that we're dealing with. So that's our first chapter. There's a few other body cavities that we'll talk about as we go through, as you'll see, but it's not necessary to memorize this list right now. Okay, so that's it for chapter 1 of our anatomy and physiology text, our introduction to anatomy and physiology. And the next chapter we'll examine is chapter 3. We'll jump right to a chapter on cell biology and just take a look at a few